What is it about social media that draws the breast cancer community together? I'm going to explore this question with my guest. We're going to look at the benefits, downfalls, information, disinformation that is provided by various social media platforms. How can you find the right community that supports both your emotional and educational needs when each person is unique and there are distinct types of breast cancer? Why is it important for physicians to be engaged and active on social media, or is it? I'm speaking to an oncoplastic breast surgeon who delivers phenomenal content that is evidence-based, comprehensive, and easy to understand on various social media platforms. And I have the distinct honor of being listed as an author on a published paper that we are going to discuss in our conversation today. My guest is Dr. Tasha Gandamiharja, and I also would like to acknowledge the other fellow colleagues and authors on the paper. Dr. Tasha practices in the UK. We also have listed as authors on the paper Sarah Liangi, who is an author and patient advocate herself, Dr. Ann Pellid of Sutter Health in San Francisco, and Dr. Yazan Masanat, also of the UK, who also hosts the iBreast webinar series. Dr. Tasha, I'm just going to call you Dr. Tasha today rather than try to say, with last names like we have, I know we both get various iterations and pronunciations of our
That's
names.
correct. Yes, but you did it really well. Honestly, thank you so much.
Oh,
Impressed.
absolutely. Absolutely. I'm just so glad that we connected. We are recording this during October, which is Breast Cancer Awareness Month. This week was also Breast Reconstruction Awareness Day. It's a busy month for both of us. So thanks for taking the time out. I'm glad that we connected to finally talk about this paper and the importance of social media, et cetera, et cetera. So it's really great to have you.
No, thank you. It's a great honor to be invited to come onto the podcast. And yeah, thank you so much for accommodating the few rescheduling events that needed to happen. But yeah, thank you so much for your invite. Really appreciate
Oh,
it.
absolutely. I'm going to put in the show notes too the links to your podcast, YouTube, and all of that, because sharing this information, I think, is just so important in our community. But why don't we start out? Can you tell us what your role is in the UK, where you practice, a little bit about what you do, Dr. Tasha?
Sure. So, as you mentioned earlier, I am an oncoplastic breast surgeon, so it's a breast cancer surgeon. And oncoplastic essentially means utilizing plastic surgical techniques as well as the oncology type of surgery. So it's a term that we use in the UK for those who are trained both in cancer surgery and plastic surgical techniques. So that's essentially what it means. I'm not really sure if it's used across the pond outside of the UK, but certainly that's what we use in the UK. And I work just outside of London, actually work together with one of the co-hosts of the paper, Mr. Mazanat. So we work together now. And I am involved in breast cancer care, diagnosing breast cancer patients and treating them as well.
Yeah. Yes, Dr. Mr. Mazanet. I know that you go by Miss and Mr. in the
That's right.
UK, and some of your colleagues over there explained that to us. So yeah, he does great things, and so I'm glad he um, transferred from Aberdeen in
That's correct.
Scotland and is now working with you. So that's really great. Um, you know, Dr. Tasha, I feel like you and I are in a unique situation or experience here to be able to discuss this topic, but also to talk about the paper. You see patients that are newly diagnosed at consult. I've been that patient. So, can you tell us what some of those feelings and emotions are that you experience at a first consult?
Yes, it's not always easy. Obviously, I see patients who are referred by their general practitioners to the one-stop breast clinic is where they first get through the door in the hospital setting,
Mm-hmm.
certainly in the UK. And they come to what we call the one-stop breast clinic. So that's a clinic where they will get examined by usually a surgeon. Then they will get, images, so a mammogram, an ultrasound scan, either one or both, depending on their age normally. And then
Mm-hmm.
they'll get a biopsy. Now, the majority of patients who come through the door, thankfully, are fine and they will be discharged. However, there will be some who unfortunately will be diagnosed with breast cancer. So once they've had their biopsy, they'll come back to see me usually a week later to the results clinic. And that is when I provide, I give the diagnosis.
Mm-hmm.
Just because you have a biopsy doesn't necessarily mean it's a cancer. But nevertheless, I have to break that news. And if it is a breast cancer diagnosis, then, um, you know, different people react differently. And the truth is, I prime patients beforehand if we feel it might be a cancer. So when they come through, the one-stop breast clinic, if we feel that they have a suspicious lump or suspicious mass, before they leave that clinic, I prime them to say, I think, I'm afraid this may well be a cancer. So then when they come to see me the following week,
Mm-hmm.
it is not going to be a complete shock. It can be, but at least it's been mentioned beforehand. Yes, unfortunately, there will be a week of worry, and that can be quite hard as well. But different people react differently, and you go through many, many emotions. And some people can handle it better than others. And it's my responsibility as the doctor to be able to give patients that space to be able to digest that news.
That's very, very similar to the process that we go through over here in the
Right.
US,
Okay.
at least very similar to what I went through and what I hear other women here in the US who experience imaging, biopsy. I too, before I left the imaging center that day, had my radiologist with great clarity and confidence tell me, I'm pretty certain this is a breast cancer.
Right.
Again, prepping me, and then off to a breast surgeon, next stop. So when you say, Dr. Tasha, one-stop clinic, I
Mhm.
think over here, I just want to clarify that. I think over here we call that an integrative care.
Right.
Tell us what one-stop means.
Yeah, I guess it's also known as maybe rapid diagnostic clinic, but the premise of it is essentially patients will get what's called a triple assessment.
Mm-hmm.
So I guess it's probably the same in the US, just under a different umbrella. But
Mm-hmm.
essentially, the triple assessment means that you will get an assessment examination, then you will get imaging, then you will get a biopsy.
Mm-hmm.
So that's the triple assessment part of that clinic. So that's essentially what it means, rather than in the past where people would come, say, to see a surgeon for examination on one day, then they'll go away and then have the imaging on a day later or the next week, and then they
Mm-hmm.
come back for their results. So it's a little bit disjointed then. Now it's all done during one day. So that's
Mm.
what a one-stop breast clinic essentially means.
Okay, thank you. Well, so you have patients in your clinic, and now you have to tell them about the diagnosis. Let's say that you have someone who has a confirmed breast cancer diagnosis, or even, I know this is a little bit different, but, or even a patient who is at high risk and they have found that they have a genetic mutation, putting them at higher risk. How much of the information, when they sit with you and have this discussion, how much of the information, not looking for a number here, but just kind of a ballpark, do you think they're really absorbing when they start to talk to you about this diagnosis?
Yes, that's a good question. And it's very difficult to discern with certainty how much information one retains. And I think it does depend on that particular person. As I said, it varies from one person to the next. I can tell whether somebody it has completely shut down. The moment you give that diagnosis, some and understandably so, some would completely shut down, and whatever I have said after that, it's not going to be remembered at all. And with others, they are a little bit more receptive. They might deep down they know it's a cancer. They probably would have already done their research already. So by the time they come to see me, they receive that diagnosis. They just want to get on with it and just want their treatment planned. So it does depend. And it's, as I said, it's my responsibility um, to find that out, because if I know that somebody isn't really taking anything on board, then I would really stop that consultation. And then I will just say, look, I will always have a breast care nurse with me in these clinics, and the breast care nurse will be the patient's advocate. So when we are in a situation where, somebody would need more support, for example, then I would stop the consultation, and then the patient will go with the breast care nurse to another room to be supported. And then I will see that patient the following week. And it may take, a couple of consultations before we get to a point where we can talk about treatment. So it does depend actually between patients.
That seems like such a positive way to go about that, just to give them time and space. I always feel that breast surgeons, plastic surgeons have to be a bit nimble to be able to understand each unique personality. And so, yeah, thank you for sharing that with me. So when they're in clinic, then the processing begins. So what tools, either hard copy, healthcare apps, what do you provide for patients to begin to process this information and to sort things out for themselves and what next steps are?
So as I said, we have a breast care nurse who will support our patients when they're given a diagnosis of cancer. And they will become their nominated nurse. So throughout that kind of process, you will have a contact number. In some centers, you'll have one nurse who is your point of contact. In other centers, you may have several nurses who will be a point of contact. But there is somebody there from the nursing staff. And usually what happens is once the consultant like myself will give that diagnosis, the patient will then go away with the breast care nurse, who will provide them with a lot of information. Actually, it's hard copy. We have a pack especially made, and in those packs there will be information about various things about the cancer itself, supportive organizations that might be able to help. And it's a lot of information to take in. And many patients actually, they can read it if they want to. Some choose to read that information. Some choose not to, because it can get a little bit overwhelming. And then not only do we provide a package of information, but also the breast care nurse will then follow up that consultation with a phone call. So they will then call them, a couple of days later, to hopefully by that stage the patient would have read the information, might have further questions they want to answer. Because as I said, the initial breaking bad news, I guess, consultation, a lot of that information that I provide may not be remembered. So yeah, the role of the breast care nurse can't be underestimated, actually. They're very, very helpful.
Oh, it sounds like it. Because I don't think that's the case here in the US that everyone is provided a nurse navigator, they call them over
Right,
here.
yes. Hmm.
Sometimes it comes in the form of a caregiver who comes with them to the consult,
Right.
who serves as a second ear, takes notes, and things
Hmm.
like that. All of those things are so important. Well, I want to segue now into kind of this paper that was written that we co-authored. And I want to ask you a question because this segues into information provided, how patients process it, what next steps they kind of mentally go through. Why do
Mm.
you believe that patients use social media throughout? And not all do, to be clear.
Mm.
But
Yeah.
why do you think? I think there's a lot of patients who use social media throughout their breast cancer journey. Why do you think that is, Dr. Tasha?
I think it's because the internet is part of our lives now. And
Mm,
you can't, the first thing that they would do before they see somebody, a doctor, is to Google them, right? So it's just part and parcel of life now. And um and if you have kind of, I don't know, an itchy nose or a tummy ache or something like that, the first thing you do might be is to go onto the internet and Google. So we know that, apparently up to 80% of internet users search for health information online. And so breast cancer, comes into that. Unfortunately, healthcare providers can't provide all the information that perhaps somebody may want, given the time limitations that we have in clinic. And so, people will search for information elsewhere, not only the internet, Google, Dr. Google, but also social media, especially if you are already on social media.
mhm,
So, and I don't think patients go onto social media for information instead of what's been given by the healthcare providers. I think the majority of patients go on there to complement what they have been given already. Perhaps they have questions that their healthcare providers haven't answered in a way that they understood. Um, Health can be quite jargon orientated. And if you don't communicate certain things in a way that is easily understood, that can be quite confusing for some. So I think that's the reason why people go on
mhm.
social media, to help them perhaps understand a little bit better about their diagnosis and treatment and the potential treatments going forward as well.
I like your word complementary. I do believe that that is a complementary way of, adding to what they do and don't understand when they're in clinic
Yeah.
with you. So this paper that was written, because I am going to put a link to it, and I don't, I don't expect everyone to check out the link. It is open access. So, but for those that do, right at the front end of the paper, I have a copy of it here with me, but the way they gathered the information for this report, Dr. Tasha, is called a qualitative
Hmm.
report. So, can you help us understand why that particular method was beneficial, important to this article, this particular article?
Yeah, sure. So this research piece is a qualitative piece.
Mm,
Basically, what it means is it's a method that explores meaning of people's lives, experiences, and behaviors.
mm,
And what I wanted to do with this paper is just that, to explore, people's experiences and impact, positively or negatively, with social media. Um, and how a qualitative kind of research paper is usually done is by collecting non-numerical data. So, it's not numbers, it's experiences and
mhm.
articulation of experiences. So this is, I think it lends itself very well with the aim of this paper, because I wanted to see and find out what people's experiences are like with social
Mhm.
media. And Terry, thank you so much for participating in this paper, because I think it's a very useful paper. Definitely, I tried. We fought quite hard actually, Yazan and I, to get this open accessed, because initially it wasn't. And we thought, well, how can this not be open access? The whole point of it you know, is about social media. So we have to make it open access so that people can access it freely, like you would do social media. So we finally, got it open access, i.e., it's free to access. So, anybody who wants to read it, you can access it for free. So yeah, that's what it means, really, qualitative.
Well, you're very welcome. I mean, I was quite honored to be asked, and I'm so glad you wove in the work that you and Yazan did to make this open access. People don't always understand the nuances of that
Yes.
work on the back end. And so I'm so appreciative to both of you for working hard to make that easily accessible to patients. So thank you also. Um, so what do you see as the potential challenges and limitations using social media for breast cancer patients?
So social media is a blessing and a curse, I would say.
Mhm.
It has many positives, but it also has negatives. And I think, like anything, you ought to use it with moderation.
Mhm.
Um, I think the negatives of social media, firstly, is, I guess it's quite addictive, so that's not a very good thing. But it can, for patients who have had breast cancer, social media can be overwhelming. For example, this month, Breast Cancer Awareness Month, I
Mhm.
know of patients who just find this month extremely difficult, especially if you go on social media,
Yeah.
because uh, on social media, breast cancer is everywhere, whether it's primary breast cancer or secondary breast cancer. And some patients may not want to be reminded about their breast cancer diagnosis and their treatment. It can trigger, challenging emotions if you go on to social media, especially at this time. So I know patients who, purposefully shy away from social media during October. So
Mhm.
it can be, it can be triggering emotionally. It can take you to a place where, you're glad you're not there anymore. You want to not forget about it necessarily, but just want to put it behind and move forward. It's something that's happened in the past, and you just, you want to kind of get on with your, I guess, your new normal now.
Mhm.
Um, I think social media can also, in the breast cancer community, which I guess is what we're talking about, that it can be a little bit competitive as well. So unfortunately, people compare their breast cancers to somebody else's. And
Mhm.
Terry, as we know, somebody's breast cancer is going to be completely different to somebody else's. They will have different
100%.
experiences,
Yeah.
different experiences, different treatment options, different surgeries. You might have tolerated your treatment differently. Somebody might have had chemotherapy, somebody might not have had chemotherapy. And it becomes like um, a comparison
Yeah.
place. And you might feel that perhaps your cancer is less valid because of X, Y, and Z. Um, so yeah, that could be something that social media can lend itself to, actually,
Mhm.
competitiveness, which is not a welcome thing to to kind of find on such platforms. Um, Misinformation is another thing,
Mhm.
There's misinformation everywhere, unfortunately. And similarly, on social media, there's a lot of misinformation, and it's very difficult to sift through that.
Yeah.
Um, so that could be also a negative side of social media.
Yeah. Yes, I often tell people, shut your phone down, shut your
Yeah.
computer down, take a break, because honestly, what you said about, I mean, we know the algorithms of these platforms draw us in.
Absolutely.
And you
Yeah.
just literally and figuratively have to shut down your devices. Our mantra in our family, I've said this before, mental clearance sale, everything must go.
That's a good one.
Yeah, yes, I love sharing that. I think one of our sons came up with that during my second diagnosis because you get exhausted from trying to absorb the information and understand what your next steps are. So I'm really glad that you touched on all of those things that can trigger us, whether it's
Mhm.
during the month of October or, when you're newly
Any other time.
diagnosed.
Yeah,
Oh, yeah.
absolutely. Any other time, really.
Yeah. Yeah. Um, benefits. Let's talk about the benefits of social media.
Yeah, I think if social media is used purposefully, it has many benefits.
Hmm.
And it's actually interesting. I did a poll on my Instagram a few weeks ago, and I asked the question about social media, whether it's helpful, whether it's unhelpful, and whether it's kind of in between. And I would say just I would say 60-40. So 60% was helpful, and 40% are both, can be helpful and unhelpful. So I think, that is the overall message I feel that people resonate with, in that used deliberately, it can be helpful. And there are so many reasons why it can be helpful. So yeah, first of all, well, it's free, I guess. It's
Hmm.
extremely accessible.
Hmm.
Um, and, you can, I mean, now you can reach out to anybody who's on social media, right? And I think it is far reaching in terms of not only global reach, but also who you can reach in terms of experts. So you can gain immense amount of knowledge. I hope you can gain immense amount of knowledge from people that you follow. There is a large community of experts out there. If you choose wisely, I guess, that hopefully can help you with various questions that you may have. So increasing knowledge is one thing that is available on social media. It also, I think, provides peer-to-peer support. So, patients can reach out to other patients, um, or, anybody who have had similar experiences,
Hmm.
because you can then resonate with each other, support one another, because, people would be going through the same struggles and challenges. And I think there's a lot to say about finding your own tribe, and finding your own
Hmm.
community. And that's something that's really helpful, I think, and can be a very
Hmm.
positive thing. I know people in my community who have, found each other through following me. And they connected with each other. They've met offline because of, finding each other through my Instagram. So these things happen through social media. And I think that's fantastic.
I love it when I hear things like that.
Yeah.
When through your social media account, others have met and
Yeah.
formed friendships. That's amazing. Do you get do you get many like direct messages or private messages? And so I guess this is a good time to ask you too what the various social media platforms you see being used, and I mean, how are patients reaching out to you? Because I love your content, Dr. Tasha. I have to say, one of the challenges that I have curating my own content and having the Deep Sea Foundation and Deep Sea Journey, one of the true challenges I have is just not being able to visit the really premier content deliverers. I consider you one of them, and
That's very kind.
well, I mean it sincerely, um, and resharing that. So I segued there a little bit, but do you get lots of messages from folks, and what social media platforms do you see people using the different ones?
Yeah, I think in terms of what social media platforms people use, probably Instagram, TikTok to a degree,
Hmm.
and YouTube.
Yeah,
And I do have a disclaimer to say that I can't provide personal advice. I can't give you personal advice because that's beyond my remit. You know, doctor-patient relationships cannot be formed
yeah,
on such platforms. And I can't give personal advice. So people do come and ask certain questions about their, conditions, and unfortunately I can't help you in that. I would love to, but I can't.
right,
That's not what I can do as a doctor.
right.
um Patients actually rarely contact me through social media. My patients,
Hmm.
I think I do try to have that boundary. And if somebody contacts me through social media, then I would um, redirect them to the hospital. Say one of my patients, I would redirect them and politely ask them to make an appointment to see me by the hospital.
Hmm.
Um, but I do get a lot of questions, personal questions, and unfortunately, I can't answer them. And there is that boundary that has to be maintained.
You know what? I'm so glad you brought this up because I just had an Instagram live yesterday with one of your associates. I'm going to call him an associate, but you have interviewed him, Dr. Minos Chrysopoulou, who has the
Yeah.
Breast Advocate app. I know I'm name dropping here, but it's for a reason, Dr. Tasha. And he said that when you curate content like you both do and educate the broader general public in breast cancer care, you cannot give specific answers to their, and that becomes challenging. And
Yes.
I would add to this too that as patient advocates, that is a responsibility that I hold very seriously. We can give general answers as well because on our Facebook pages,
Hmm.
or on our Instagram accounts, we do get private messages, or in this larger private Facebook group that I have. I think we have to be so careful and responsible as patient advocates not to tell patients and give medical advice
Yeah.
and strongly redirect them. This is a question you need to ask your healthcare provider.
Mhm.
But I do think patients get on there to share experiences, and that's okay. I had a seroma after, I'm not saying that I did, I'm just giving an
Sure, sure.
example of
Yeah.
something. I had a seroma after my reconstruction or my mastectomy. What did that feel like to you? What did you do? Well, they just want to know, kind of what the experience was with other
Yeah.
patients. But if they're asking, I have a seroma, what should I do now? My
Yeah.
set pat answer, call your healthcare provider, call your
Yeah.
surgeon, call your physician. So anyway, um, okay. So you kind of answered this question. I was going to ask, who should we be guiding patients to when choosing social media for breast cancer care? You kind of touched on that. Do you have anything else you want to add to that? What
I
should they
mean,
be looking for?
it's really it's difficult in that, if you because social media is kind of the Wild West in a way.
Yep.
Um, and it's I think the advice is to try to, you may talk to your peers to see who
Mm-hmm.
they're following. That could
Mm-hmm.
be a good step.
Mm-hmm.
Um, but try to, I guess, look at their content, see whether, it looks credible or not. You might
Mm-hmm.
want to Google that particular person to see what they are like, outside of social media.
Mm-hmm.
A good thing for me to mention, actually, so I'm on YouTube as well.
Mm-hmm.
And in YouTube is really trying very hard to dispel or to curb misinformation. So in health. And what they have done is, which I think is a great idea, is they've created what's called a health shelf. So um, certain channels, if you want to be, I guess, accredited by YouTube to be seen as reliable, you have to apply to go on YouTube's health shelf. So you have to meet certain criterias. YouTube will then verify if that's all legitimate and correct. And if they think you are, a trustworthy channel, when you go on somebody's channel, it will say something like, this channel belongs to a UK licensed practitioner or something like that. So that is something perhaps when people go onto YouTube to see whether that is the case, it will be on their channel. So if people go to my channel, Dr. Tasha, there should be just underneath kind of the big banner thing, there will be, like a statement to say just that. So that's another, and the reason why YouTube has done that is hoping to help signpost people to information that is, reliable and accurate, which I think is a great thing. That isn't happening on, on like Instagram and TikTok. But at least, certain platforms are trying to do that.
I hope the other platforms just heard you.
Right? I think that's great, right? I think that's a
I,
fantastic idea.
is that just in the UK? I had no idea about this.
I think it's in the US too. But yeah, it's a thing, and it's quite, you have to apply to be on the health shelf.
Yeah.
And yeah, I'm part of what's called the clinician creator group with YouTube here in the UK, and we're very kind of we're trying very hard to kind of propel this information to be more reliable and accurate, and that's one of the things that has been put through. So yeah, it's a really good shout out to YouTube.
Every time I interview a new guest, I learn something new. That's my
There you go.
big takeaway today, Dr. Tasha.
Yeah, yeah.
So here's something else I'm very protective about. A lot of times industry or even other, social media platforms, they want to hear the patient's story. Well, that's lovely. That's lovely. But how do we protect that patient's story when they're really in a vulnerable place?
Yeah, I think um that can be quite tricky, can't it?
Mm-hmm.
Sharing stories, I think, is one of the most powerful things we can do.
Yeah.
You know, whether that's any story, right?
Goes back
Stories are
to
very
ancient times. That's how
exactly
we
story
gathered. Yeah.
exactly,
Yeah.
word of mouth. Um, and people learn so much from each other's stories.
Mhm.
And I think, as a patient, if you just have to make sure that you are willing to share your story. And if you share that story on social media, for example, you have to be aware that potentially, you might get comeback from that.
Mhm.
So, as I said, social media has to be used deliberately and purposefully. Um, whether that's creating content, as a content creator, whether that's by commenting on a comment, because ultimately you are talking to somebody. There is somebody at the end of that device.
Absolutely.
We forget, we
Mhm.
because it's faceless,
Yeah.
anonymous. We forget that there's actually somebody at the end of that device,
Absolutely. And
and
being affected by your story.
that's right. Yeah. So yeah, you just have to be mindful, really.
Yeah. So do you think a couple big questions to wrap all this up today? Do you believe, do you feel, do you think, do you see your colleagues on social media? Do you think it's an important part of practice? Just no right or wrong answer here. I'm curious.
I think, I mean, surgery as a specialty is quite a conservative, conservative um, domain, and
Hmm.
medicine as well, but surgery more so, I would say.
Hmm.
Um, but I think one of the reasons why I decided to go on social media was patients would ask me certain things, and I, you know, as I said at the beginning, unfortunately, I don't have the time to perhaps want to go into a great amount of detail to answer questions. So somebody might
Mhm.
say, "Oh, I read this on somewhere that said if you wear an underwire bra that causes breast cancer," which is obviously a myth. Now, you know, I don't have, I would love to be able to kind of have a long and deep, meaningful conversation to say why that is a myth, but I don't have the time. And therefore, I decided to do this, to go on social media, because I thought, um, at least I can provide, accurate information, and I can direct patients who might be looking for something in particular. I say, look, actually, go here. I've done this piece on whatever,
Mhm.
and have a read about it. So that's the reason why I went on social media. I thought, um, there's a lot of noise out there,
Yeah.
and if I provide kind of a bit of noise, but at least it's kind of accurate, reliable information, then hopefully that will suppress the other kind of nonsensical noise out there. So that's one of the reasons. I think more doctors are looking at social media in a more positive light,
Yeah.
because at the end of the day, social media and the internet are here to stay.
Yeah.
Uh, Platforms may come and go, but reliable information is very, very important. And people are going to go onto the internet to look for it. So,
Yeah.
yeah, I think healthcare providers are going to embrace it a bit more, I
Yes.
think.
Yes. And I have to tell you, sometimes when I meet new doctors, and they're starting a new practice or whatever, I'll say, because it's my set pat answer, I want to connect with them on social media. And I'll say, "Oh, are you on social media?" And they go, "No." And I look at them and I go, "Good choice." Because you've gotten into a rhythm. And I think for new practitioners, and unless they just have exuberant energy to be able to deal with this, I I'm just going to say do it with a slow roll.
Hmm.
Do it with a slow roll. Whether you're a surgeon, physician, or a patient advocate, this is like you said, it is the Wild West. It's a wild ride and it's a learning curve. You and I both have been doing this a while, so we're in a rhythm. We
Hmm.
kind of know what to look for, what to expect. All
Yeah.
right, big question to end with.
Hmm.
AI. I always
AI.
I AI, how do you think AI is going to affect the information, whatever, in social media for breast cancer patients? I ask the question because, yeah, comes up a lot.
AI. Well, I think, deep fakes, AI, that's a bit scary, isn't it?
Oh, yeah.
And yeah, I guess, discerning what is fake and what is real, probably can be a little bit difficult sometime in the future.
Mhm.
Um, but I think AI as a tool will be helpful in breast cancer diagnosis, um, in the long run. It's going to be
Mhm.
used to screen cancers on mammograms. I'm sure in the not too distant future, there's already been big trials, in Sweden, for example, one of them to show whether it's, um, you know, non-inferior to humans. And I think it's really promising. So yeah, AI is going to play a big, big role in helping cancer detection. Um, but also, yeah, in terms of information,
Mhm.
yeah, that's going to be a gray area, I would
Yes.
say. So just beware.
Yes, just beware, but it's here to stay, and I do think we have to learn it and embrace it. I think our job today, you and I, and all our other wonderful surgeons and patient advocates who curate responsible content, is to guide patients in that realm. Uh, we are adding to AI right now with these large language models.
Exactly. Yeah. I mean, AI is amazing. ChatGPT is amazing,
Yeah.
the future, yeah, it'd be interesting to see what the future holds.
Yeah. Yeah, the different platforms. I, again, this has just been delightful for me, mostly because of that little bit of information you gave me today. Guess what I'm going to be doing today when I'm looking on YouTube? Um, I just truly appreciate your time, Dr. Tasha. And when I sit and listen to you now, I know why I go to your social media accounts, and we will put them in the information for listeners because you're a very calming person to talk to, but you're confident. I know that I'm blowing you up, but I'm saying this because I'm I'm blowing you up with sincerity. What I want patients to feel what I'm feeling right now is this calmness, confidence, and intentional and purposeful information that is being shared on social media, which I hold you in high regard. So it's been delightful to have you on the channel, the podcast today. We will have this on YouTube and the DiepCJourney podcast. So thank you so much.
No, thank you, Terry. And I just want to also say thank you for all the work that you do. You do such amazing work on all the platforms that you have, a true patient advocate for so many. And I really do appreciate all the work that you do as well. But thank you very much for your kind words. And again, it's been an honor to be on your podcast.
Thank you. It's
Thank you.
just been delightful. Take care.
Take care. Bye bye.
Bye.